I got interested in headache medicine while I was in residency, my neurology residency. I just found out that I sort of have a gift for it. I could listen to the patients, and I had the patience to listen to them and diagnose them properly and find out what their problem is. Then once I did that, I could plan a treatment for them, and I had good success.
My first visit with Dr. Sadeghi, what I noticed was he understood what I was talking about. He listened very intently. He heard what I said. And when I got done, my sister came with me to the appointment. When I walked out, I said, he got it. He knew what I was talking about.
The experience with this office, the personnel, the therapist, has been outstanding. I come in, I talk to them between my therapy sessions. I tell them what I've experienced from one session to another. They listen, they go through, and they do what they need to do to correct what I've indicated to them. And then we follow up on the next therapy session as to whether there's been an improvement, stay the same, or not.
The treatments are specific to each headache. Many patients think that they have migraine, for example, or they have cluster headache, and they've been diagnosed with such headaches. Whereas they come in and we do our workup, we do our history tests, and we find out that, for example, the migraine is not the migraine, is due to a herniated disc in the neck, or is due to bad allergies to molds or dust, or so on and so forth.
I think the treatment here has been different in that their approach all along has been to look for the cause of the problem and not just treat the symptoms. And while I've suffered a lot because they're not quick to prescribe pain medications, ultimately it's been a good thing because it's helped me make some changes in my life that I needed to make to help my situation improve.
It was affecting my life to where I was in anger all the time. I was upset. I was constantly fighting with coworkers, arguing with family members. I didn't want to do anything with my husband. I just wanted to stay inside, basically going through a downward spiral towards depression. And with the treatment, it's made my life so much better.
So then we treat that cause. So if it's allergies, we treat the allergy. If it's the neck, we treat the neck. If it's muscular tension, we treat the muscle tension with neuromuscular therapy. The center is a very comprehensive center. We cover almost every cause of headache and every type of headache, and we offer treatment in those, but specific for that type of headache.
Well, according to my wife, I'm not near as dizzy walking around the house. I've been able to be more active outside doing things that I enjoy doing.
I'm sitting upright. I'm not nauseated. I'm thrilled with what I am.
My suggestion is for people to really try to focus on the cause of the problem. Try to stay as active as possible, but you need to find out what's causing it and try to figure that out and fix that, as opposed to just treating your symptoms with drugs.
I have recommended this office to several coworkers, people that are not disabled veterans and others that are just regular civilian life that I work with coworkers, and they've actually have come here and they're now permanent patients because they enjoy the fact that they offer more than just surgery. They offer the capabilities of living with this that's going on.
Any patient who suffers with headache is a good candidate to come and to see us. Some patients have gotten used to their headaches, and they come to a mutual agreement with their headache. Say, well, okay, I'm going to ignore you. I'm just going to live with you, although I'm suffering and I'm taking medications every day. So even if you're in that shoe, you should come and see us. Don't give up on it. I always tell my patients, don't give up. Even if I'm not able to help you, you shouldn't give up on it. You know, every doctor has a different point of view, it has a different angle, different approach, and eventually you will find someone out there who's able to help you. So any headache, any whether it's bothering you, whether it's paralyzing your life or not, whether you've come in peace with your life, I think you should see us or headache specialists for that matter.